We are the Association for Child and Adolescent Mental Health, or ACAMH for short.
Hello, and welcome to the Papers podcast series for the Association for Child and Adolescent Mental Health at ACAMH for short. I'm Mark Tebbs, I'm a freelance consultant. Today I'm really pleased to be talking to Dr. Alessio Bellate, who is the co-author of the editorial for the JCPP Advances special issue entitled Evidence-Based Child and Adolescent Mental Health Care, the role of high quality and transparently reported evidence synthesis studies. Alessio also authored a paper in this special issue, and we're going to be discussing both publications. So, welcome. Really lovely to be speaking to you.
Hello, Mark. Hello, everybody. Thanks very much for having me today.
Great stuff. So, we'll start by talking about the editorial. Could you start by introducing yourself?
Yes, my name is Alessio Bellato. I'm a lecturer in child and adolescent mental health at the University of Southampton in the UK. I started working on this editorial while I was at the University of Nottingham, Malaysia. So I would like to thank first Henrik Larsson, who is editor-in-chief of JCPP Advances, who involved me in this project and asked me to contribute to the editorial. So I collaborated with him, and then there were other people on this editorial. We have Ioana Alina Cristea from the University of Padova in Italy. We have Cinzia Del Giovane from Reggio Emilia and Modena, Italy. And then we have Sina Fazel from University of Oxford, Guilherme Polanczyk from Brazil, the University of Sao Paulo, and lastly, Marcus Olmi, who is in Canada at the moment.
Thank you. It'd be really useful if you could define some of the terms you use. So particularly, I'm thinking evidence-based synthesis studies, and if you could pick out some of the highlights, that'd be great.
Okay, so yeah, this is a new experience for me. It is my first editorial ever. So again, I'm very thankful to our editor-in-chief, Prof. Henrik Larsson, for giving me the opportunity to work on this. So when we talk about evidence synthesis studies, we are basically referring to different types of studies like systematic reviews or meta-analysis or umbrella reviews. So this special issue, I think it was basically designed and created already in early or late 2021. So basically there was a call for papers, and then authors could submit their ideas that were reviewed by the editors, and then they could submit their papers basically. They were looking for a specific type of study, such as systematic reviews, which are basically summaries of the literature, but done in a very rigorous, very systematic ways. So very informative for both clinical practice and research. Or meta-analysis. So meta-analysis is a bit of an advancement of systematic review, where a very specific type of statistical analysis is done to, again, summarize, pull all the data about a certain research question, certain topic. So the idea is that, we want to provide an updated overview of the literature on a certain topic. And that's actually what has been done in this special issue. So in this editorial, we summarized the 13 evidence synthesis studies that were included. But we also did something more that I think that we are talking about in a few moments.
Yeah, so it'd be really good if you could tell us how you did that qualitative analysis of the papers.
It was again an experiment. So when we were discussing with the editor-in-chief, about how to discuss these papers, we say, okay, let's do an experiment. Let's try to appraise the quality of these publications, and not just to see if they were good. We knew that they were, good publication because they underwent a very rigorous peer review process, and editors looked at that. But what we wanted to do is really to try to identify what were the kind of similarities and differences between the different studies, and also write down some recommendations, some guidelines for authors that in the future, they may want to publish with JCPP Advances. So what we did, we used a specific tool, which is called AMSTAR tool. This is basically a series of questions about each of the publication, specifically in relation to the manuscript, so the article. So basically how things were reported in the paper. Like, for example, did the authors pre-register their study and publish the protocol before conducting it? So basically, when you use this tool, you answer the question with a yes, with a no, or with a I'm unsure about it. And then at the end, you can really see, what are the similarities again and the differences between the different papers. So I did the same for each of the 13 studies. And what we found basically was again that the quality of the papers that were accepted and then published in the special issue was very, very high actually. And the studies were more or less consistent in reporting the research questions transparently. They all included a protocol where basically they pre-registered their research question before conducting the study, which is very important actually. There were just some differences in, for example, reporting who did what during the systematic review process. And we know this is very important, especially nowadays. We have this rise in the use of artificial intelligence tools, even for research. And we know that when you do a systematic review, basically you screen all the papers that you find. And we know that nowadays specific tools which are based on AI have been created to support researchers in doing that. So what we think is important, from now on is this should be acknowledged basically. So if you use a specific AI tool, but also it's important, to do this independently. So usually you have at least 2 researchers working on the same papers at the same time, because you want, again, to be very rigorous and then you cross-check, what they have done. So it's important to report these very, very consistently in the papers.
That's really interesting. What were the good practice recommendations that came out from the work?
Yeah, this is another very important point and something that we discussed with our current editor-in-chief of JCPP Advances, Prof. Henrik Larsson. So what we thought, we thought it would have been good to provide authors who may be interested again in publishing with this journal, but also peer reviewers who may not be fully familiar with this technique, with a series of recommendations, a series of good practices that we encourage them to follow from now on, when again they are preparing a manuscript to be submitted to JCPP Advances, or when they are reviewing one, for example. So obviously I'm not going to talk about a full list, so I suggest our listeners to have a look at the editorial. It's quite short, hopefully quite easy to read, so have a look at that. But I think it's important to highlight what I think the main recommendation is, which is basically to be transparent in reporting the main information about the study that you want to publish. What were the original research questions and the hypotheses? How was the screening conducted? How was the study conducted? And also what level of quality the studies included in a systematic review had. And another important recommendation, because for those of you who do not know JCPP Advances, this is a journal that is entirely based on open science. So it's very important to report. If you want to publish a systematic review or meta-analysis, try to provide as much as possible your codes, your analysis, and if possible also your data, and a clear description of how you analyze your data, so that you can keep the study very open and readers can fully understand what you have done. And I think this is a very important recommendation that I have.
Yeah, I agree. I think it's a really important editorial. Can we turn to your paper? You're the co-author for the paper, and it was called The Autonomic, Dysregulation and Self-injurious Thoughts and Behaviours in Children and Young People, a Systematic Review and Meta-Analysis. Could you introduce the people that you worked with?
Yes, this was a very interesting and real collaboration that involved researchers at different levels of their career, working in Malaysia, working in the UK, and working in Brazil. So I work with Dr. Giorgia Michelini from Queen Mary, University of London, and Dr. Elizabeth Shepard, who is based at the Universidade de São Paulo in Brazil. They helped me basically manage the project. And then we also had Dr. Margherita Malanchini from Queen Mary, University of London, who brought her expertise in child and adolescent mental health. And it would also be important to thank all the other co-authors who helped with the systematic review. We have Muskan Alisa Admani, Camila Dick, Luis Carlos Farhat, Maria Carolina Fontana Antunes de Oliveira, and Rebecca Vasconcelos.
Thank you. Could you just start by giving us a brief overview of the paper?
This was, I think, an important paper also for me because it was a real collaboration. So we had basically researchers working from Malaysia, where I was based at the time when I was working on this, people working in the UK and people working in Brazil. So it was quite a large collaboration, and I'm very happy about the fact that it was published in JCPP Advances. So what we did in this paper was basically summarizing the existing literature and also conducting a meta-analysis to understand if children and young people who experience suicidal thoughts or self-harm, they also show difficulties in regulating specific bodily mechanisms, such as, for example, calming down when they experience a negative emotion. So this was the main goal of this paper, which was at the end a systematic review and meta-analysis.
So could you describe those kind of original research aims?
We know that suicidal thoughts and self-harming behaviors are unfortunately very common in children and young people. What we do not fully know and fully understand nowadays is why some children and young people actually experience this and why many others do not. So one theory that is quite popular in the literature is that suicidal thoughts and self-harm could arise from other mental health difficulties that are associated with difficulties in arousal regulation. So let me explain what I mean with the word arousal. So arousal refers basically to the level of activation of our body at a certain time. And we know that arousal changes based on the context, based on the situation, and based on the time of the day as well. For example, now, it's after lunch, so people may be, a bit tired, and I'm sure that, your level of arousal, your level of activation is slightly lower than, for example, let's say 10 a.m. this morning. And similarly, think about when you get angry, when something, bad happens in your life, our body tends to activate, tends to become more aroused. We call it, basically to be prepared to face the situation and cope with it. So what we do as humans is basically regulate arousal. So if we are too bored, too tired, or we are too overexcited, too activated, too angry, for example, we kind of try to restore the level of arousal to a level that we are comfortable with. Something that makes us feel good, basically. So the idea is that some children and young people, but also adults, who experience suicidal thoughts and self-harm, may actually engage in these behaviors because they may experience some difficulties in voluntarily regulate arousal. And arousal is something that we can measure, for example, by looking at heart rate and changes in heart rate based on the situation. We have some evidence, for example, that people who self-harm report feeling better and more relaxed immediately after self-harming. So it could be that this is really a strategy for them to improve their well-being, at least temporarily. And we know that many studies actually looked at these associations to try to understand again if there is an association between arousal regulation, self-harm, and suicidal thoughts. So what we wanted to do, and this is our primary research goal of this paper, was again to summarize the literature on the topic, to try to reach again a conclusion. Is there strong evidence in favor of this hypothesis, or maybe we don't really know yet what's going on? So this is actually what we did.
So could you tell us how you did it? Could you tell us about your methodology?
Yes. So this is obviously general discussion about how a systematic review and a meta-analysis is usually conducted. So basically what you do, again, you set up your research question, which is what I've just talked about, and then you develop what we call a search strategy. So a series of words that you need, to search for papers that are relevant to your research question. It's like going to the library and ask the librarian to say, hey, I would like a book on vegan meals. I want to prepare a vegan meal and I don't know how to do it. Can you suggest me a book for that? And obviously, they will probably search for them with these key terms. That's what you do at the beginning. So you basically identify specific keywords and then you search in online databases. You download all the papers. So basically at the beginning of the study, we had more than 5,000 articles that we screened one by one. So we, at least two people actually, looked at the title and the abstract of each paper and determined if they thought that the paper was eligible for inclusion. And then after you have identified all the potentially relevant papers, basically you look at the full text. So you go online, you go to the journal page or through the library, you get the full text, read the full paper to determine actually the eligibility. And at that point, you have to try to have a look at the bigger picture. If I take all, and we had basically 20 articles that at the end were relevant to answer our research question. If I consider all of these together, what are these papers? What are these articles telling me? And then you can also use meta-analysis, which is, again, a statistical method where you look at the numbers, look at the results, and try to pull them all together to have basically a larger sample. You try again to understand, what is the conclusion about your research question? Are most of the papers in favor of your hypothesis or against, or is there a mix? And this is a very interesting process, which takes some time. So it's important to have researchers who are already somehow expert in conducting systematic reviews, or people who want to learn, which is usually what I have. I have students, who want to learn, and with appropriate supervision, they can learn about it. And it's a nice skill to have as a researcher.
Yeah, great description too. What did you find? What were the key findings from that process?
So the good news is that the findings were in line with our hypothesis. So what we found is that children and young people, so we summarized these 20 papers altogether. So this finding does not come from 1 or 2 papers. It's basically, taking all the papers, 20 papers in consideration. And we found that children and young people displaying self-injurious thoughts and behaviors indeed show difficulties in regulating some bodily mechanisms, specifically heart rate. So what we found a specific index of arousal dysregulation, specifically lower heart rate variability, which is thought to reflect, reduced ability to basically regulate cardiac activity. And we found this in children and young people experiencing suicidal ideation and self-harming, basically.
Okay, so let's turn to the implications of that. Tell us what that means, maybe from a clinical perspective, first of all.
Yeah, so again, as I said before, we know that self-harm and suicidal thoughts are very common in children and young people. We have about 1 out of 4 children and young people, according to the last statistics, experiencing either suicidal ideation or self-harming. So in order to appropriately support them, it's important to identify them, first of all, especially because, as I said before, many of these children also experience other kind of mental health difficulties. So some of them may not be able, to communicate properly that they are struggling, for example. So the idea, with this type of paper, with this line of research, is try to identify some kind of markers of, in this case, suicidal ideation, suicidal thoughts, and self-harming behaviors. We are not there yet. So we cannot use, for example, heart rate variability or heart rate to identify those who are more at risk, for example, of developing suicidal ideation. But what we can do, and this is actually why it is important, we can work towards understanding if heart rate variability can be used in clinical practice as an objective marker of mental health and well-being. For example, to see, okay, if I try, intervention A or this specific management support strategy, does heart rate variability change? Because if heart rate variability is a kind of a marker of mental health, mental well-being, maybe we would be able to understand, more efficiently and more accurately what intervention works best for that specific child, that specific young person, for example.
Thank you. I'm just thinking about, we've got a lot of parents and carers and teachers who listen at the moment. Are there any implications or messages for them at the moment?
This is a message that I don't think comes only from this specific paper, but from different papers, from the whole literature that we have on the topic of, for example, suicidal ideation, self-harm, but also emotional dysregulation. So if we look at the literature, parents, carers, and teachers, they can somehow pay particular attention to those children and young people who are somehow, more irritable than others. They may show rapid changes in mood. Maybe, especially when they are young, they seem to struggle more in self-regulating, in calming down when they receive bad news, when they could not play, with their favorite toy, for example, or when they experience negative emotions. Because in some cases, these are actually the children who may be experiencing mental health difficulties and may cope with these with some strategies that are not really helpful for them, such as, for example, self-harm. So to these parents, to these teachers, if you're worried that a child or a young person that has suicidal thoughts or engages in self-harm, or they show emotional dysregulation, sometimes it's just important maybe to offer to listen to them, give them space, find a way that they are comfortable to express their feelings. And obviously, if possible, I think this is a general recommendation, suggest them to consult a professional that knows how to best support them.
Yeah, brilliant. Thank you. So we're coming towards the end of the podcast. I'm just wondering whether you could tell us whether there are any implications from a research perspective from your work.
Yes, and I think this is very important because, again, all the literature is now suggesting that, we may be able to support children and young people who struggle. We really need to find interventions that are effective, But we also know that if we have one intervention that is effective for one child, it doesn't necessarily mean that the same intervention works the same for another child. So what we have to do as researchers is first try to understand how the interventions that we commonly use in clinical practice, for example, psychotherapy or medication, how do they affect our ability to regulate our bodily functions, such as heart rate? Because if we identify the link, then we may be able to understand more how these interventions actually affect mental health, mental well-being, and also how they are affected by the presence of, for example, more complex profile. Let's think about a child with attention deficit hyperactivity disorder who also show emotional dysregulation. So this is something I'm planning to do in the future. So try to understand again how interventions that we currently use in clinics in the UK, but also more globally, how do they affect heart rate variability? So if anybody who's listening, is interested in collaborating with me in the future, please be in touch. It would be great to work together.
Great stuff. Could we just finish up with a final take-home message for our listeners?
Yeah, we are doing a podcast, and from what I know, I don't know much, but I know that podcasts are aimed at making our research, our work as researchers somehow more accessible, more clear to the general public. And I think this is a general recommendation that I also have for authors who submit and publish systematic reviews and meta-analysis, something that we talked about in the editorial. We know that many policymakers, politicians, but also clinicians and healthcare professionals, they use this type of study, they use systematic reviews and meta-analysis to guide their own practice, but also to make important decisions for the whole society. So considering that, the paper that I published is a systematic review and meta-analysis, and the editorial is on systematic review and meta-analysis, I think it's important to highlight and stress, again, about the importance that we write our papers or our systematic reviews by, for example, including a lay summary so that everybody can understand what the paper is about, what the study is about, or a short overview of the main findings, at least, so that, again, everybody can understand what we did, why we did it, and how what we found is important.
Brilliant. Thank you. That's a really important leaving message. So thank you so much for your time. It's been a really interesting podcast. For more details on Dr. Licio Bellato, please visit the ACAMH website, www.acamh.org, and Twitter @ACAMH. ACAMH is spelled ACAMH. And don't forget to follow us on your preferred streamer platform. Let us know if you enjoy the podcast with a rating review, and do share with friends and colleagues.